Hi, this is Dr. Robert Brueck coming to you again with another segment of what's new in cosmetic surgery. My voice might be a little hoarse this week because last weekend I went to the Florida game in Gainesville where the Gators took on the Mississippi Rebels, and it was quite a game, especially if you were a Gator fan. You know, we're going to talk about radio frequency. Radio frequency is a new technology. It's been around for a while, but it's new in terms of cosmetic surgery. And many people email me and I get questions about, do we do VelaSmooth, VelaShape? It's a modality that involves radio frequency, infrared heat, and suctioning. And the whole purpose behind it is to help reshape thighs and hips and abdomen. And at the end of the day, the question is it efficacious? Is it effective? Does it really work? And a recent study showed at 4 weeks that 71.9% of people saw a reduction in the circumference diameter, if you will, of their thighs. But if you were to follow that out to 8 weeks, there was really no change in the circumference of the thighs. And I think that's true with a lot of the new technology. It's got to be repeated forevermore. If you want the results to be long-lasting, the therapy or treatments have to be an ongoing thing. So at the end of the day, you got to ask yourself, is the value for getting a reduction of 1 or 2 centimeters worth the price that I'm paying to get these treatments? So I think you have to do a little homework, be cautious, be wise when you go ahead and look at these things to see if this is something that you might want to invest in. Another question I get asked all the time is about popularity of cosmetic surgery. Have you ever asked yourself, why is cosmetic surgery is so popular? It's a $15 billion industry. And there was a recent study that I read about it. It occurred in Dallas, and they interviewed well over 700 people. And what was interesting was that over 70% of those people either had cosmetic surgery or were contemplating cosmetic surgery. And then part of the study was to ask them, why is it you're going to have cosmetic surgery, or why is it that you have had cosmetic surgery? And what was interesting was social media. Social media. Another way that social media is interacting in our lives. It's funny, you go to this weekend when we were up in Gainesville and going to the game, I see people doing selfies at the stadium. And the selfies was one of the big reasons people went ahead and would go ahead and get cosmetic surgery. They see a post of themselves at a party on Facebook or something like that, and they say, oh my gosh, is that me? Do I look that bad? And that's the thing, the impetus that starts the search to go ahead and seek out plastic surgery. So social media is pretty powerful. And as a cosmetic surgeon, I'm all for it, I guess. The number one thing that people didn't like was their neck. 40% of the people said their number one dislike was neck. Right below that was the eyes. And then just below that was the chin. So it was kind of interesting how social media and people seeing themselves in a new light is a motivating factor to seek out cosmetic surgery. Another thing that's interesting that I was reading recently was the idea of a cooling off period where government would intervene in people's ability to schedule cosmetic surgery. This is in Australia and Great Britain, and what they're considering is that people cannot schedule a cosmetic surgery for a minimum of 2 weeks from the time of the consultation till they actually have the surgery. They want to have a cooling off period. In other words, they want the patients to understand the risks involved. They want them to contemplate, to think about it. And in my practice, I rarely, if ever, will see somebody today and do the surgery in 2 or 3 days. I always like to see them at least twice to make sure that they're understanding of the procedure, the risks, the post-op course, and what is necessary to follow through and get a satisfactory result. I guess what bothers me more than anything else is once again government intruding into individual lives and taking away people's right to choose. And so I'm really kind of against government regulating. It's another bureaucracy, it's another department, again another waste of taxpayer dollars, which are so few and precious. And it seems that government sometimes just kind of flits them about as if they were, you know, limited limitless, and they're really not. So I really sort of am against that as a way of regulating or trying to regulate plastic surgery. Another thing that's kind of interesting, and we do it all the time, is mirror dry for, excuse me, for excessive underarm sweating. Now they have Mirror Smooth. So I call it the trifecta. Mirror Smooth is the microwave technology to remove excessive underarm hair. And I call it a trifecta because, number one, you stop excessive underarm sweating, you stop the odor, and you stop a lot of the unnecessary hair. Occasionally you might have to have a little extra session for some of the unwanted hair and get a laser hair removal. But what's really nice is this works with any kind of hair color. For example, laser hair removal usually depends on people having dark pigmented hair. That's what makes it effective. Well, with Mirror Smooth, it works almost with any kind of hair. So something to think about. You get less sweating, less odor, less hair. Not a bad idea. Another question that I don't think it's ever going to be resolved is, should plastic surgeons be the only ones to do cosmetic surgery? I read articles all the time in different journals, online, people Facebooking, Twittering. Who should be the ones to do cosmetic surgery? It's a huge industry. As I mentioned earlier, it's a $15 billion industry. And as insurance reimbursements have fallen off the table, more and more people are reverting to cosmetic surgery to create a new income stream. We see more and more primary care doctors, gynecologists. I was in the operating room the other day, and one of the nurses came in and says, Dr. Brueck, one of the gynecologists, would like to borrow some of our breast implants. So the question is, who should do cosmetic surgery? Obviously, I'm biased. I'm a plastic surgeon, so I think it should be plastic surgery. I think our training is far superior to any other specialty when it comes to overall cosmetic surgery. There's no question that some ENT people or ophthalmology people are very qualified to do eyelid cosmetic surgery or facial cosmetic surgery. But at the end of the day, I think it's blurring of the lines to allow anyone to do cosmetic procedures. Today it's the Botox and fillers, then it's the lasers, then it's a little mini facelift. And so I really think as a consumer, you really have to be very prudent, very wise, and do your homework. And as I was thinking about this question, who should it be, I boil it down to two things. I think number one, skill. There are some people that I've known in this community, and this is not just unique to Southwest Florida, this is true all over the country, that lack the requisite skill to be plastic surgeons, general surgeons, whatever. There are guys that I know that are board certified plastic surgeons that really are not very good plastic surgeons, and they could be plastic surgeons for 35 or 40 years, they'll never be good plastic surgeons. So skill is really a prerequisite to being a good surgeon, and either you have it or you don't. And I think a skilled surgeon is somebody that can change their technique. If they see something's not working properly, they can change their technique to create greater success rates and better results in their patients. So skill is very, very important when it comes to selecting a surgeon. The second aspect that I think is critical for patients to look at when they're contemplating plastic surgery is experience. The one thing that's unique about experience is you don't get it by reading a book. You don't put a disc into a computer or a DVD and watch a 1-hour tape on how to gain 35 years of experience. The one thing I always tell my patients, my 36 years of experience goes to the OR with you every time that you go ahead and select me as your surgeon. So experience is so vital, so important. So skill and experience are important when selecting a cosmetic surgeon to do your cosmetic surgery. Another thing I want to comment on about BBL. It's not a new candy or a new dish. It's Brazilian buttock lift. It's very, very popular. In fact, last year saw the greatest increase in popularity. And basically what it is, it's transferring fat, robbing Peter to pay Paul. You take fat from, say, the inner thighs, the flanks, the hips, and you transplant it to the buttock area. And it's a nice way to go ahead and recontour, if you will, the shape of the buttock to make it fuller, rounder. It's amazing how many people have a flat buttocks or have an asymmetry. In other words, one side may be fuller than the other. Now, I don't do buttock implants. I just think the complication rates with buttock implants is just too high because of the anatomic area. But I think doing autologous fat is a great thing. But if you're contemplating a Brazilian buttock lift, I think it's important to have realistic expectations. One of the things that I see in my practice when women come in to see me for a Brazilian buttock lift is the fact that you have to have the requisite donor sites to have the fat to place into the buttock. It's important to understand I can't go down to Home Depot and say, listen, can I get a couple pounds of fat? It just doesn't work. Now, I know some people have gotten tire inflators and different things like that to inflate into the buttock, but at the end of the day, you have to have the requisite fat to put into the buttock. I can only put in what I take out. It's important to understand too that it is a graft. You're taking from one part of the body and transplanting it to the next. Not all of that fat is going to survive. In the buttock area, 40 to 60% is going to survive. But the good news is it's your tissue. So whatever takes, takes. And the rest that doesn't take, your body absorbs. So a Brazilian buttock lift is a nice way to enhance body shape. And for example, if somebody has a big roll of fat in their lower back, we can take that fat and transplant it from that area, put it into the buttock. Or if they have large hips, we can shrink the hips and put it in the buttock. So it's a nice way to contour a patient's backside and make their buttock area more shapely. Saline implants. I prefer silicone implants 99% of the time. I rarely will use saline implant. But there's a new implant on the market. I have not tried it. It just got FDA approval. It's called the Ideal implant. The idea is the manufacturers of silicone implants are told by the FDA they have to put a warning in there, you should get an MRI every 3 years to check for silent ruptures or leaks. I would say 90% of my patients don't. The Ideal implant is a saline implant that has 2 compartments. And the idea is that this will eliminate the risk, if you will, of silent leakage of silicone into the body. It also supposedly gives a softer, more natural feel to the breast. And that's always been one of the big selling points of silicone. It's soft and more natural. So far, I have not been approached by salespeople for the Ideal implant. I have not tried it. I have not seen one. I certainly look forward to investigating, if you will. And of course, at the end of the day, too, the question is, what is the cost going to be? So much of this is bound down in cost. People say, for example, the preformed breast implants, some of these implants are costing $22, $23, $24, $2,500 a piece. It really puts it out of the price range of most people. So the Ideal implant may be an alternative in individuals. Then the other question comes up, is the Ideal implant, because it's saline, adjustable? In other words, put in 200, 205, 210. That was always one of the big selling points of saline implant. You can adjust it to go ahead and meet the needs of the patient if they had some sort of asymmetry. So you'll hear more about the Ideal implant and give you an update on it. Again, I want to say thank you for taking time to listen. Again, if any of you have questions about cosmetic issues or procedures or new products, feel free to contact me at RJ Brueck, B-R-U-E-C-K, at abodyandface.com. Or just go to my website, beautybybrueck.com. Have a wonderful week and the riches of God's blessings to each and every one of you. And thank you again.